weirdly close. So this is a phoropter. So this is a device that we use to assess your prescription for your glasses or your contact lenses. And it's basically just a big box full of little lenses. So it allows us, we've got lots of buttons that we can turn on here that adjust the power of the lenses. So the alternative is something that you may have seen that looks like this. So it's a trial frame. And what we do is that we would mount lenses in separately. And the difference just between this and the phoropter is that all the lenses are mounted in a wheel on here, so it's just more convenient. The most important thing is you're sitting comfortably so that your head position against the backside of the phoropter is fairly constant. And then other than that you can see through the little holes, and then we do the rest with your help or without your help. There's an outside dial here. This allows us to change a lens type that just changes the focus, essentially, very much like what you would have in a binocular when you rotate the eyepiece, that kind of thing. But obviously we're doing in very small increments here. And then there's another lens down here that we might use if you have what we call astigmatism, which means that the correction that you need requires a particular power at a particular orientation. Most of you will have, that have had an eye exam, will have seen something like this, where we use this device here and say, do you like number 1 or number 2? And in that instance, what we're doing there is we're asking you to tell us which one's clearer, so that we can make a judgment about where what the power needs to be. And the irony is of course, is that when it's difficult to tell between the two options, that's actually when we know that we are at the end. So from your side, I also wouldn't worry if you're like going, oh, I can't tell the difference between 1 or 2 and they both look awful, because from our side that's actually telling us something, and we can make the appropriate adjustments on this side, even though you may feel like you've got the answers wrong because it's not perfectly clear, because we're not finished yet.